Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. The feature presentation is salt versus salt substitutes. Which one? First of all, we need to decide why you need a salt substitute. Then we'll look at all the different aspects related to the salt substitutes and see which one best suits your needs. Let's talk about regular salt. Regular salt, 26 ounces jar will cost you like $1.12. That's about 6 cents per ounce. Keep that number in mind because that we're going to be referring to again. Your daily intake of salt should be no more than 2.3 grams. Your daily intake of salt should be less than 2.3 grams. And if you have history of heart failure, hypertension, or kidney failure, then the salt intake should be anywhere from 1 to 1.5 grams per day. So that's where your doctors may recommend you to get a salt substitute to reduce the amount of salt so it does not make your heart failure or kidney problems worse. In order to keep your blood pressure down, they may also recommend you to look at salt substitutes. In addition to salt being a preservative, which is used in practically almost all frozen canned foods, it is also used in sports drinks where it is healthy to have sodium and potassium in the sports drinks because if you're in a hot summer day outside and you're sweating, then you're going to need to replace that sodium and potassium, which could be life saving. I have a whole separate chapter on heat stroke and heat exhaustion and heat cramps. You can watch that one and understand why you need to have salt and potassium in your drinks, especially if you are outdoors on a hot summer day, like it is in Houston, which is almost half the year. However, the regular salt that we use, or the regular salt that is in your processed foods that you buy, or canned goods, all of them have salt, and it can increase your blood pressure. Because the salt retains water, it can make symptoms of heart failure and kidney failure worse. So it is under these circumstances where your doctors may recommend you to get a salt substitute, and let us look at what are all the different options available. There are a whole host of options available. We're going to just look at a few of them and give you guidelines as to how to evaluate a salt substitute before you spend that money, because these salt substitutes are not cheap. They are 10 to 20 times more than your regular salt as far as the cost is concerned. Most of these salt substitutes have one salt, that is a sodium chloride, replaced with a potassium, which has a very bad metallic taste, which most people don't like. And also, it doesn't exactly taste like salt as you expect it to. The alternatives to salt in heart failure and kidney failure are important, but we have to see what best suits your pocketbook and what suits your taste and what suits your underlying conditions like high blood pressure, heart disease, or heart failure, or kidney failure. All right, so there are some alternatives to salt itself, or in terms of reducing the amount of salt that you put in your food. That is, if you use a lot of chili or lemon, pepper, cumin, mustard, and a whole bunch of spices, which are very famous in our Indian grocery stores. When you add all these spices, the amount of salt that you need to add to get the flavor and taste could be much less than if you're just purely using salt to give you all the taste, which is what most restaurants do. What most restaurants do is they add a lot of salt, they add a lot of oil, they add a lot of butter. They don't care, they want you to buy their product. But if you're having a heart problem and you go sit in a restaurant and you get 2 to 3 grams of salt for your lunch or dinner, then you're in deep trouble that night with more symptoms. So let's get back to more practical stuff here. Let's look at some of these salt substitutes and look at their pros and cons. Okay, the first one is the dash, which is most common, which most people are familiar with, and the dash one, I think it's a 3-ounce jar, costs about $2.82. It has a lot of spices. See, as I was telling you, you can add spices yourself to increase the taste and flavor and reduce the amount of salt. So obviously it has black pepper, parsley, basil, bay, I don't know, oregano, thymes, mustard, cumin, rosemary. You can look at this and make your own mixture by buying all these ingredients from your grocery store. So anyway, this has all these different kinds of naturally occurring spices. So this is different from many other salt substitutes which replace your sodium with potassium. That is, you're replacing one problem with another, which I'm going to talk about in a minute. So this is about Dash, which is reasonably priced, and if it meets your taste and if it meets your requirements, then maybe you should try it out. The next one is Morton salt substitute. It says sodium free, but it is replacing sodium with potassium. But in patients with heart failure, in patients with high blood pressure, in patients with kidney failure, the very fact that you are concerned about sodium, you should also be concerned about potassium. Because of the medications you are taking or because of the kidney failure, your body may retain potassium. So if you're going to replace salt with potassium, sometimes people come to the hospital with very high levels of potassium, which is more dangerous than having more salt. So you need to be very, very cognizant of the fact that potassium in the presence of heart failure and kidney failure can be quite dangerous unless your potassium level is closely monitored. So keep that in mind. And besides that, Morton salt substitute is not cheap. It's like a 3 1/8 of an ounce. A 6-pack is $28.08 on Amazon, or you may get a better price on Walmart or some other place. But the main thing you need to keep in mind is that replacing sodium with potassium is not the simple answer to the very reason you're taking a salt substitute. That is, if you're having heart failure or if you're having kidney failure. Keep that. Okay. Having said that one, let's move on to no salt original sodium free substitute. Again, this is another potassium derivative, just like the Morton salt, and it is also quite expensive, $19.50 for a 2-pack. What is this? I don't know, it's 3 ounces, something like that. But you get the message. So if you're having heart failure and kidney failure and you're substituting salt for that reason, you need to be concerned about not only salt, but potassium also, because potassium can cause irregular heart rhythms and it can cause much more problems. Okay, Himalayan Chef Pink Salt. This is like $15 for 5 pounds. But this is an extract from the salt mines in Punjab in India. It's supposed to contain 84 different minerals. And I looked at it. I mean, I have not tasted it, but there were mixed reviews on Amazon. And it's supposed to have a strong chemical smell. So you have to decide, especially if you're taking as a substitute for heart failure or kidney failure or hypertension, you need to know exactly what you're getting, because the ingredients may be causing you more harm than the actual sodium itself. So keep in mind, the next time you look for a salt substitute, look at what are the contents of that salt substitute. Number 2, how does it taste? Number 3, does it meet your requirements based upon your existing medical condition? And then you make an intelligent choice. Anyway, there's another one, new salt. New salt is another potassium derivative, or it is replacing sodium with potassium. The same story goes for this one as it goes for the other potassium containing salt substitutes. You need to watch out for potassium excess in the presence of kidney failure. That can be quite harmful. Anyway, here are some very important shopping tips. Beware of frozen foods and canned foods. They use sodium chloride, that is regular salt, as a preservative. As a result, now we come to table tasty. It's another salt substitute. It's pretty steep in price, $10.99 per bottle. It has no sodium, no potassium. Just like the other one which I showed you, it has all these extracts like Candida albicans, carrot, red chili, red bell pepper, onion, lemon, citric acid, and a whole bunch of herbs and spices. So this has no sodium or potassium. So this may be useful if you are concerned about sodium and potassium. So this is a good alternative to try. It's pretty expensive, but how expensive is it compared to a high blood pressure or heart failure medication, which could be $200-300 a month, or a visit to the hospital with fluid overload, which could cost you several $1,000s. So looking at that way, I think you need to just try out a couple of these different samples and see which one suits your taste and your needs based on your medical history. Sodium content in those are going to be pretty high. Number two, all your, like tomato juice, for example, here. I just picked this one. You pick any other tomato juice, like V8, 6-ounce can has like almost half a gram of sodium. I'm talking about, it's not sodium chloride, it's just sodium itself. So that's a pretty high amount of sodium for 8 ounces of drink, which probably takes you like less than a minute to drink. And if you're having heart failure or kidney failure, then that can make your symptoms worse, or it can shoot up your blood pressure if you continue to drink tomato juice on a regular basis. So always beware when you have liquids that are in a can. They always contain salt to preserve the ingredients, and always look for the amount of salt content in every item before you put them in your shopping cart. The other alternative is you can look for salt-free alternatives, which you can get. There are salt-free canned goods. I don't know how they preserve it, but if you get a salt-free alternative, like in a frozen section, then I would use that one and put salt substitute to get the taste where you want it to be. So ladies and gentlemen, these are some of the tips on how to shop for a salt substitute, what to look for when you're looking for a salt substitute, and how you can get low sodium foods from the grocery stores and try to bring up the taste with salt substitute. Thank you so much for watching this presentation. We have hundreds of videos on your cardiovascular health. Please do watch them, and please do subscribe to our YouTube channel, and I will see you in the next presentation. Thank you so much for your time.